You know, when we think about obesity, our minds usually jump to things like heart disease or maybe diabetes. But what if one of its most serious dangers was actually affecting every single breath you take? Today, we're going to talk about a serious but often overlooked condition called obesity-hypoventilation syndrome. It's a situation where the physical weight of the body literally starts to suppress the simple automatic active breathing.
So that brings up the big question, right? Is obesity just about the number on a scale? Or does that weight put a physical pressure on our bodies that can fundamentally change how we function? Well, as we're about to see, the impact goes way deeper than a number, all the way down to the basic balance of oxygen and carbon dioxide in our blood.
All right, so here's how we're going to break this down. First, we'll define what this syndrome actually is and see how it physically puts the body under pressure. Then, we'll play detective and follow the clues that lead to a diagnosis. And finally, we'll look at how doctors manage everything from an emergency room crisis to finding a real long-term solution.
So let's dive right in with the basics. What exactly is this thing called obesity-hypoventilation syndrome? You can really think of it as a triple threat. First, you have obesity, which is clinically defined as a body mass index over 30. Second, that leads to something called hypoventilation, which is just a fancy way of saying your breathing becomes too slow or too shallow. And the result? A pretty dangerous chemical imbalance in the blood.
And that imbalance brings us to a really critical number. When the pressure of carbon dioxide in your arteries, what doctors call the PaCO2, creeps up above 45 torr, that's a state called hypercapnia. Torr is just a unit of pressure, but what it means is that your body isn't breathing out enough CO2. That waste gas is building up, almost like a traffic jam in your bloodstream.
And then, you've got the other side of the coin, oxygen. When your arterial oxygen, or PaO2, drops below 70 millimeters Hg, it's called hypoxemia. This means your body is literally being starved of the oxygen it needs to function. So you've got this double whammy. Too much waste gas building up, and not enough essential fuel coming in.
So how does this actually happen? I mean, how can physical weight literally stop you from breathing properly?
This analogy just absolutely nails it. It's not about willpower, it's pure physics. All the excess fatty tissue around the chest and the abdomen acts like a constant heavy weight. It's squeezing you, restricting the simple mechanics of breathing 24 hours a day, 7 days a week. And you can see the domino effect this creates. That heavy vest physically restricts your chest wall from expanding. This shrinks the total amount of air your lungs can even hold. Over time, the lungs themselves become less flexible, less stretchy. This forces your body to work so much harder for every single breath, and eventually, it can even dull the brain's own automatic signal that tells you to breathe in the first place.
So, with all these physical things happening, how do doctors even begin to piece together the clues to make a diagnosis? Well, it's a really careful process of elimination and confirmation.
The diagnostic pathway is super logical. You start by confirming obesity, and then you get the hard numbers from a blood gas test to see what's happening with oxygen and CO2. From there, it's all about gathering clues from the patient's symptoms and a sleep study. Finally, lung tests help lock in the diagnosis while also making sure to rule out other conditions that might look similar.
And these symptoms are huge clues. We're not talking about feeling out of breath after running a 5K. We're talking about getting winded just walking to the mailbox. The loud snoring is a big red flag. And those morning headaches, that's a classic sign of high CO2 levels building up overnight. It's a clear signal from your body that something is going very wrong with your breathing while you sleep. Now, this chart might look a little technical, but it shows a key piece of evidence. The lung function test reveals what's called a restrictive pattern. Basically, the total amount of air the lungs can hold is smaller, but the rate of airflow itself is normal, and that's the critical clue. It tells doctors the problem isn't an obstruction inside the airways, like with asthma or COPD. No, the problem is a physical restriction squeezing the lungs from the outside.
So once the diagnosis is made, what's next? Well, the treatment path can look really different depending on how sick the patient is when they first get help.
For a patient who's in a full-blown crisis, there's a huge fork in the road, and the decision really hinges on their blood pH. If it's below 7.25, their blood has become dangerously acidic from all that CO2, and they need immediate, life-saving support with a mechanical ventilator in the ICU. But if they're more stable, doctors can often use non-invasive support, like a BiPAP mask, to help them breathe without having to intubate.
Now, for a stable patient, treatment often starts with something called CPAP, which provides one steady stream of air to keep the airway propped open.
If the CO2 levels are still too high, they'll often switch to BiPAP, which is a bit more powerful. It gives a higher pressure when you breathe in and a lower one when you breathe out, which actually helps do some of the work of breathing. And if oxygen levels are still low, they can add supplemental oxygen to the mix.
But here's the thing, and it's a really important thing. All of those machines, the CPAP, the BiPAP, the ventilators, they're all treating the symptom, which is the poor breathing. They don't actually fix the underlying cause of the problem.
At the end of the day, the single most effective way to resolve OHS for good is to go straight to the root of the problem, and that is managed weight loss. It's all about finally taking off that heavy vest we talked about earlier.
And the good news is there are established, medically proven pathways to do this. It usually starts with supervised diet and lifestyle changes. If more help is needed, there are specific medications that can assist. And for cases where those methods just aren't enough, bariatric surgery is a highly effective option to achieve the significant weight loss needed to completely reverse the condition.
And this really brings us to our final thought. Fixing the breathing is absolutely life-saving, of course, but by treating the root cause of OHS, by removing that physical pressure, what other health issues also start to heal? Things like heart strain, metabolic problems. It just goes to show how incredibly interconnected our body systems really are, and how one big positive change can create this powerful ripple effect of recovery through the entire body.